I wanted to point out other ridiculous commentary in The Dying Citizen by Dr. Victor Davis Hanson. The paragraph reads: such short term debt is often roughly commensurate with the payments and sharecropping arrangements that pre modern peasants once entered into with lords and made it impossible for the serf to exercise political independence or hope for upward mobility. The chief contemporary difference, of course, is that the modern American peasant is the beneficiary of a sophisticated technological society that allows him instant communications, advanced healthcare, televised and computer driven entertainment, inexpensive food, and a social welfare state. These material blessings often mask an otherwise shrinking middle class without confidence that is in control of its own destiny. A fifth of America receives direct government public assistance. Well over half the country depends on some sort of state subsidy or government transfer money, explaining why about 60% of Americans collect more payments from the government than they pay out in various federal income taxes, and various healthcare entitlements, tax credits, and exemptions, federally backed student and commercial loans, housing supplementals, food subsidies, disability and unemployment assistance, and legal help. So, Hansen is pointing out that yes, a high percentage of Americans rely on public assistance, and he is sad that people can't be more self-reliant. Kind of Thomas Jefferson's Yemen ideal of the gentleman farmer. Okay, that said, he's omitting something very important. So one thing that he's omitting, he talks about our advanced medical care in the United States. According to the World Health Organization, they did a study of the best healthcare systems in the world. The United States was actually ranked, I believe it was the 34th. You can check it, but it's in the top 30 countries in the world, but not in the top 5, not in the top 10. So, again, there are even third world countries or developing nations that had healthcare ranked higher than the United States. Next, another thing to mention is that when we want to talk about transfer payments, the liberal or conservatives or right wingers often like to think that liberals or progressives make the government poorer or make the country poorer. The actual statistics are that the Republican states take more money from the federal government than they send to the federal government. The Democratic states send more money to the federal government than they take. Long story short, the Democratic states subsidize the Republican states' poverty. Also, the Democratic states have a more educated citizenry with better health outcomes. The Republican states have a less educated citizenry with worse health outcomes. Also, he talks about the advanced medical care in the United States. Now, look, I know this is just anecdotal. Many people in the United States do not go to the doctor because they're afraid of the huge bill that they're going to get, whether it's to see a specialist, whether it's to see a general care, whether it's to see the dentist. The only people in the United States that are getting phenomenal health care are rich. So this Dr. Victor Davis Hanson, I know this is a New York Times best-selling book, but this man is out of touch. I know people in my friends and family that will avoid going to the doctor because they're afraid of the horrendous bill that they may get that they may not be able to pay. So when he talks about American peasants being beneficiaries of a sophisticated technological society that allows advanced health care, that advanced health care is really, those benefits are really only accruing to the rich, if we're being honest.